Now, it's a medical problem that's not often talked about, not having complete control over one's bladder or bowels. And in Singapore, between 5 and 14% of the population suffer from some form of incontinence.
Now, the problem is now being tackled by colorectal surgeons at Singapore General Hospital. And for more on this, we're joined by Senior Consultant in the Department of Colorectal Surgery, Dr. Cherylin Fu. Thanks so much for coming in.
Thank you very much, Steve and Glenda.
Now, I want to make some joke about fireworks and explosives, but I suppose it's a bit inappropriate.
Not too appropriate.
No, but tell us the problem and so the probable causes.
Right. Well, incontinence, basically, it's a lack of control of your bladder or your bowel. And so you can either have urinary incontinence or fecal incontinence. And like you mentioned, it's not something that's very pleasant or that patients or people like to talk about, but it is quite common. And it gets more common as you age, obviously, for various reasons. And perhaps I'll talk about fecal incontinence first. Fecal incontinence is where you can't really control your bowels that well. And it could be due to a sphincter problem. A sphincter basically is the muscle that encircles the anus. So when there's a problem with it, like it's weak or it's broken, it might not work that well. Or it could be due to a nerve problem, which involves the pelvic nerves that supply the bowels. Or it could be even a prolapse problem, which means that when your rectum starts to sag as you get older, and all these contribute to fecal incontinence. And similarly, urinary incontinence can be caused by a variety of reasons, such as overactive bladder or even bladder prolapse.
So, but then recently, it seems that surgery can help this.
Yes. So surgery, there are many ways that we can actually help incontinence, and that's something that a lot of people are not aware of. There are also many different types of surgery that can help incontinence depending on what the cause is. One of the methods that we have been using actually for a couple of years, or actually quite a number of years in Singapore, is something called sacral nerve modulation. And it does help in a certain group of patients with some types of fecal incontinence, as well as urinary incontinence due to overactive bladder.
So it's not, the surgery doesn't help everybody. It depends on the type of incontinence you have.
Exactly. And it also depends on, so what we'll do is we'll do a workup of the patient, and we'll see what exactly is the problem. Is it a problem of prolapse, or is it a problem of the muscles or the nerves being weak? If it's a problem of prolapse, then surgery to fix the prolapse, where we sort of move things up and hitch things up, the pelvic organs up, would help. If it's a problem with a muscle or a nerve problem, then sacral nerve modulation is one of the methods that may help. But of course, there are other non-surgical methods, such as injections or medications. So it really depends on a case-by-case basis.
Now, am I right in thinking then you mentioned muscles? It can be a muscle issue, and muscles can be exercised and trained. Is that a non-invasive way of perhaps helping the situation?
You're absolutely right, because the first step of usually incontinence treatment is usually something called pelvic floor exercises or biofeedback. It's basically a form of training where we sort of try and get the existing muscles to try and work as much as they can. But that doesn't always solve the problem.
And obviously, when you age, it gets more difficult.
Exactly. And sometimes when the pelvic muscles get so weakened, even exercises won't help enough, and that's where other modalities come in.
So, getting back to surgery, how does it work? What's the success rate like?
Right. So it depends on what type of surgery we're talking about. Maybe I'll just talk about sacral nerve modulation. Sacral nerve modulation is actually electrical stimulation of certain pelvic nerves.
This is what we're seeing on the screen at the moment.
Yeah, that's right. That's the one. So it delivers a little bit of current through a lead. A lead is like a little thin wire that's placed at the backbone. And it's delivered with a pacemaker, or we call it a IPG, which is an implantable pulse generator. You can sort of think about it as like a pacemaker for the heart. It's almost the same device, actually, that's placed not at the heart, but at the buttock area. And it's connected to a wire. The wire is then connected to the nerves, and it delivers a little current to sort of stimulate that nerves that help with the bladder and the bowel function.
So what's the success rate like?
So it depends on the outcome of the patient, but we know that long-term successes in successful implantations can be as high as 70 to 80% improvement of more than half of their incontinence episodes. So, for example, if someone were leaking stools or urine, say 4 times a week, they may be down to 1 or 2 times a week. And that would be great because then they can get about their daily activities, have a better quality of life, even travel. Yeah.
So urinary and fecal incontinence, something that not a lot of people like to talk about or like to think about. What would your advice be to someone that thinks they may be, showing early signs or beginning to suffer from it, but are, too shy to ask for help?
I think the take-home message would be, don't worry about talking to your doctor about it. It's always confidential. Your doctor is not going to tell your friends or your relatives about your condition, but it's always good to seek help because you never know that it might actually transform your life. You may not require surgery, but at least if you get treated, if you get sorted out, you might be able to get back to your normal quality of life.
That is good advice. Thank you so much, Dr. Cherylin Fu, Senior Consultant from the Department of Colorectal Surgery at the Singapore General Hospital.